Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. Traditional MRI captures beautiful, high-resolution snapshots of your joints while you lie completely still. But what happens when your pain only occurs when you bend your knee, flex your ankle, or rotate your shoulder? That is where dynamic MSK MRI comes in. Today, we are exploring dynamic and kinematic MRI. We will explain what patients experience during motion studies while breaking down fast pulse sequences, T2 cartilage mapping, and kinetic coils for our technologist community. For patients, standard MRI scans are taken while you lie flat and motionless. While this is perfect for detecting structural tears in ligaments or tendons, some joint problems are dynamic, meaning they only happen during movement. Conditions like patellofemoral instability, shoulder impingement, or joint clicking often look completely normal on a resting scan. Dynamic MRI captures the joint in motion, catching subtle subluxations and tissue pinches that stay hidden during still scans. If your doctor orders a dynamic or kinematic MRI, your scan experience will feel slightly different than a routine visit. Instead of remaining in one position, your technologist will use specialized non-magnetic positioning rigs or positioning wedges to move your joint incrementally. You may be asked to hold your leg or arm at specific flexed angles for a few seconds at a time while fast imaging sequences run. You will wear ear protection throughout, and your technologist guides you through every single step. For our technologist and student community, acquiring dynamic motion data requires balancing temporal resolution with spatial detail. Routine fast-spin echo sequences take minutes per acquisition, making real-time motion tracking impossible. Instead, we utilize balanced steady-state free precession sequences, such as TrueFISP, bSSFP, or FISTA. By recycling residual transverse magnetization, these sequences deliver high T2/T1 contrast and high SNR at frame rates of under 100 milliseconds, allowing smooth dynamic cinematic visualization of moving joint structures. Beyond dynamic motion, modern MSK MRI evaluates articular cartilage health at the biochemical level using T2 mapping. Normal hyaline cartilage consists of a tight collagen matrix that restricts water molecule mobility, resulting in low T2 relaxation times. When early osteoarthritis or cartilage degeneration begins, the collagen matrix breaks down, increasing water content and mobility. T2 mapping calculates pixel by pixel T2 relaxation times, producing a color-coded map that pinpoints pre-structural cartilage breakdown years before physical tears show up on standard FSE sequences. Because musculoskeletal structures require sub-millimeter spatial resolution, signal-to-noise ratio is critical. Always select dedicated, multi-channel, flexible, or shaped surface coils tailored to the specific joint. Bringing the coil elements as close as possible to the target anatomy maximizes the coil filling factor. High localized SNR allows us to use smaller matrix sizes, thinner slice profiles, and higher spatial resolution without extending acquisition times. Body position significantly impacts joint kinematics and spinal alignment. In supine imaging, gravity is eliminated, which can reduce intervertebral disc bulging or joint space narrowing. Weight-bearing tilt MRI systems allow scanning under true physiological loading. Under axial load, intervertebral disc height decreases, spinal canal dimensions narrow, and meniscal displacements become more pronounced, providing diagnostic data that directly correlates with the patient's standing symptoms. Imaging patients with previous joint replacements or orthopedic hardware presents severe magnetic susceptibility challenges. Metal implants cause severe local magnetic field inhomogeneities, resulting in signal voids and geometric distortion. To minimize these artifacts, implement metal artifact reduction sequences, increase readout bandwidth to shorten sample time, utilize view angle tilting to correct in-plane distortion, deploy slice encoding for metal artifact correction or MAVRIC to resolve out-of-plane distortions. The diagnostic power of dynamic MSK MRI directly changes surgical outcomes. By mapping exact joint trajectories and biochemical cartilage health non-invasively, orthopedic surgeons can pinpoint mechanical impingements before entering the operating room. This reduces the need for exploratory diagnostic surgery and allows care teams to design targeted, personalized rehabilitation protocols for athletes and patients alike. Dynamic MSK MRI bridges the gap between anatomy and biomechanics, providing an incredible look inside the human body in motion. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe. And check out our merch store for more cool medical imaging items.